Hello and welcome to another TLDR video. With the virus continuing to spread around the world, nearly all countries have been negatively impacted by the virus, with cases ballooning rapidly in a number of countries. Of particular note, Brazil. Having seemingly come from nowhere, Brazil now has one of the highest case rates in the world. So in this video, we're going to explain what exactly happened, and how Brazil found itself in the position it does now. It's been a few weeks since we last mentioned it, so let's shout out a classic. As regular viewers know, we make a whole bunch of pin badges featuring our countries with shoes design, and we have a whole load of different designs, including Brazil. In fact, the profits from that Brazilian badge go to the WWF's work to preserve the Amazon rainforest. Check out that badge and all of the other merch we have by clicking the link in the description. First things first, let's look at Brazil's monumental rise. Having registered their first death from the virus on the 16th of March, within just 2 months, they reached 15,662 deaths. And according to the Johns Hopkins Coronavirus Resource Center, at the time of recording, they currently stand at 614,941 cases and 34,021 deaths. In fact, to illustrate the speed at which Brazil's situation declined, let's take a look at the bar chart graphic we use in our videos quite a lot. Here you can see the total death toll of the 10 most affected countries, and you'll notice that Brazil is nowhere to be seen on the graph. That is until the end of April, when Brazil enters in 9th place, before almost immediately racing up the graph and landing itself in 3rd place. If you want to find out more about how countries compare, and see the full bar chart race, then click the link to the video on that in the description. So, what's truly behind Brazil's explosion in cases? In part, it's been due to the deliberate decision to put Brazil's economy at the forefront of any plan, and the perceived downplaying of the virus. Towards the beginning of the crisis, Brazil's president, Jair Bolsonaro, consistently played down the potency of the virus, claiming it to be a little flu that has to be faced realistically. But when asked by journalists at the beginning of May about the rapidly rising case of the virus, when deaths stood at just over 5,000, Bolsonaro responded, "So what? What do you want me to do?" And that, "My name's Messiah, but I can't work miracles." But it would appear that many, rightly or wrongly, attribute most of Brazil's failures down to Bolsonaro. The president has been very active in opposing the lockdowns implemented by states across Brazil. Throughout the crisis, his administration has refused to endorse stay-at-home orders, with Bolsonaro even holding rallies in an attempt to convince people that everything is fine. Rallies in which Bolsonaro is on horseback. This is in stark contrast to the rest of the world, where most countries have implemented some sort of lockdown in an attempt to flatten the curve. What is particularly concerning, and lies at the heart of some of the rapid spread of the virus, relates to favelas. As published in the Lancet Medical Journal, about 13 million Brazilians live in favelas, often with more than 3 people per room and little access to clean water. Physical distancing and hygiene recommendations are near impossible to follow in these environments. Many favelas have organised themselves to implement measures as best as possible. With the very same editorial concluding with some gravity, leadership at the highest level of government is crucial in quickly averting the worst outcome of this pandemic, as is evidence from other countries. In our Brazil series, the authors concluded the challenge is ultimately political, requiring the continuous engagement by Brazilian society as a whole to secure the right of health for all Brazilian people. Brazil as a country needs to come together and give a clear answer to the "so what" by its president. He needs to drastically change his course, or must be the next to go. Bolsonaro has faced criticism from state governors too. The governor of the state of Sao Paulo said there is no leadership. President Bolsonaro is not leading Brazil at such a serious and difficult time. He's acting as an army captain who has no knowledge, no scientific experience in health or public health, who works according to what he thinks, on assumptions and personal desires, on a subject very serious because it has to do with people's lives. Professor Anthony Pereira, director at King's College London's Brazil Institute, believes that Bolsonaro's strategy is an electorally focused one. I think his strategy is to try and play the blame game, like what Donald Trump is doing in the United States. playing the governors off against the rest of the population. It's so that he can say, if he gets to 2022 and he has chances for re-election, I know the economy is bad, but that's because of the governors. Former President Luiz Inácio Lula da Silva, commonly known as Lula, who was barred from running against Bolsonaro in the 2018 general election, spoke to The Guardian when Brazil's death toll stood at 1,924. At the time, he branded Bolsonaro's actions as grotesque, and that it's natural that a portion of society doesn't understand the need to stay at home or how serious this is, especially when the President of the Republic is a troglodyte who says it's just a little flu, and in effect called for his impeachment. If Bolsonaro continues to commit crimes of responsibility and trying to lead society to the slaughterhouse, I think institutions will need to find a way of sorting Bolsonaro out. And that will mean you'll have to have an impeachment. It's no secret as well that Bolsonaro hasn't gelled well with his health ministers during the crisis. Luiz Henrique Mandetta was Brazil's health minister, and he was fired by President Bolsonaro for urging people to observe social distancing and stay indoors. Mandetta has since, talking to BBC's Hard Talk, acknowledged Brazil underestimated the spread potential of the virus during the very beginning of the outbreak, likening it to SARS in 2002, and only realizing the gravity of the situation when it was too late.
It seemed to us here that the virus would be what we call here a heavy virus, a virus that didn't have much ability to really spread around. It seemed much more like a SARS in 2002 than a virus that would be so capable of spreading. But when we saw Italy, when we saw France, when we saw Spain, when we saw England, and then we paid attention to the United States, and the United States, Mr. Trump was very comfortable on saying that he would take care of that. We really thought that he had some kind of science that would be released soon.
Mandetta's successor, Nelson Teich, resigned after less than a month in the job. Although Teich offered no formal reasoning behind his decision to resign, many suggest it was a result of continued disputes on the handling of the virus, including being kept out of the loop with the plans to reopen the economy, with the final straw being related to the use of chloroquine. It hasn't helped that Brazil's testing numbers have consistently lagged behind those of similarly affected countries. This means that Brazil's case count is likely far higher than the numbers are actually showing. This is not a good sign for the country moving forward, especially with the high number of rural communities lacking adequate medical staff and equipment. That's not to say that Brazil hasn't made some positive moves during the crisis, though. Given the potential damage that fake news could cause, the health ministry has been relatively proactive. A WhatsApp number exists where citizens can forward images and texts they wish to confirm as true or false, and has published a searchable list of false theories, ranging from the beliefs that masks from China have been contaminated with the virus, and that coffee prevents catching the virus, to the belief that drinking water every 15 minutes, or when warm and mixed with salt and vinegar, all cure the virus. And for the avoidance of doubt, all of these are false. But the proactive move by the ministry cannot be underestimated, regardless of the broader circumstances. And acts by other government officials to stop fake news are especially important when Facebook had to delete a video of Bolsonaro claiming that hydroxychloroquine was totally effective for treating the virus. So, what do you think of the situation? Is Bolsonaro to blame, or are there other factors in the mix? Let us know your thoughts in the comments below, and also tell us what you think about your country's response to the COVID outbreak. And do you think that your nation has been able to react better than Brazil? As always, you can also get involved in the conversation over on Discord. We currently have over 3,000 members on our server, where they discuss all kinds of topics, from the latest news to daily debates and non-political topics. Also, every Sunday, Team TLDR members jump on the server to host a live quiz, so get involved in the server and join the conversation by clicking the link in the description. Be sure to subscribe to the channel and hit the bell icon to be notified every time we release further videos. You can also find more from us across all social networks simply by searching for TLDR News. Special thanks to our Patreon backers who make videos like this one possible.